Today's article is a no-frill, no-anxiety talk about certain types of gynecological symptoms that should be consulted with a doctor without delay. This video has two sections. First, there are 5 important symptoms to keep an eye on. The second part is about some other specific gynecological problems to be aware throughout your life. So first part, 1. Abnormal vaginal bleeding or discharge. Every woman has a personal rhythm to her periods or bleeding. This rhythm varies for each woman, but if it is interrupted or becomes irregular, especially after 40, it is necessary to consult a gynecologist. Before 40, slight or heavy regular bleeding is usually treated with medication, sometimes even without searching for the exact cause. But after 40, the approach changes. Before prescribing the medication, it is essential to investigate the cause to determine the exact reason. Is there an unknown problem hiding inside the inner lining of the uterus? Bleeding between periods is known as intermenstrual bleeding. Bleeding after intercourse is called postcoital bleeding. All needs to be presented to doctor. Any bleeding after menopause, known as post-menopausal bleeding, should also be seen by a doctor. If any type of vaginal discharge does not decrease and keeps increasing, or if the problem persists despite medication, a diagnosis is needed. Timely consultation can ensure the right treatment without panic. 2. New onset abdominal pain. Even without gynecological problems like bleeding, it is crucial to get an ultrasound scan for new onset abdominal pain. Ovarian problems often present with other abdominal issues without gynecological symptoms. Usually, ovarian problems are not considered initially, leading to delay in diagnosis. Especially if this pain occurs after 45, it is better to see a doctor promptly. While infections or endometriosis are common causes of abdominal pain in younger women, it is necessary to investigate the cause of abnormal pain after 40 rather thoroughly. 3. Bloating or distension. Many women experience bloating for a few days, a month during their period, which is normal. But persistent or recurring bloating requires a doctor's consultation to check for hidden ovarian problems. Stomach swelling is not always due to weight gain. If the stomach is swollen, seek medical advice. Sudden weight gain or loss also requires correct diagnosis, even if there is no gynecological problem. 4. Itching or burning in the vulva. Discomfort and burning in the vulval area can come and go, and fungal infections are not uncommon. However, if the irritation persists despite repeated use of medication, or if there is any discharge or bleeding, consult a doctor for proper diagnosis. The area of the skin outside the vagina between the thighs is called vulva. If such problems persist, a proper vulval examination is necessary. 5. Any lumps or ulcer. If you notice any lump or ulcer on genital skin, consult a doctor without delay. Sometimes such swellings can be caused by infection. Even if the problem seems to be minor, it is better to treat it as per doctor's advice. Self-medicating without a proper checkup can lead to missed important information and delay in diagnosis. Now we come to the second part of this survey, where you need to be aware of some specific gynecological problems, as important issues may be hidden behind them. Abdominal pain during intercourse. If you experience abdominal pain during intercourse, see a doctor and get an ultrasound or MRI scan to check for any underlying problems. Sometimes non-cancerous causes such as endometriosis or ovarian or cervical tumors need to be ruled out. Blisters on vulva. Blisters on the vulva can sometimes indicate infections like herpes or other conditions, so it is necessary to check your sexual health. Warts on the vulva need proper treatment and testing to ensure that there are no precancerous problems hidden behind warts. Next problem, urinary leakage. If you experience small amount of urine leaking while sneezing or coughing, don't forget to get an abdominal ultrasound along with a gynecological exam. Most of the time, such problems are due to minor issues like prolapse or something like that. But there may be other hidden abdominal problems such as swelling in the ovary or uterus mimicking such symptoms. Next symptom, urinary leakage. This symptom is common in women after menopause. Sometimes it is a manifestation of a problem related to diabetes, and sometimes it is due to urinary infection. However, if the problem returns after initial treatment, it is necessary to get an abdominal ultrasound to find out whether any ovarian problems are responsible. Sometimes swollen ovaries or uterine tumors can cause this type of problem, which we often ignore as urine infection issue. Sudden lower abdominal pain. If you have sudden lower abdominal pain, you definitely need to get an ultrasound scan of the entire abdomen. Sometimes ovarian cysts or tumors can twist on themselves and create this type of problem known as torsion. This type of pain can also occur due to bleeding or other accidents in ovarian cysts. If there is even a slight possibility of early pregnancy during lower abdominal pain, go to the doctor to check for an ectopic pregnancy possibility. At least get an urine pregnancy test done. Ectopic pregnancy is a pregnancy that occurs within the fallopian tube rather than within the uterus. It is not cancer, but since we are discussing red flag symptoms, you need to be aware of such symptoms. Water accumulation in the abdomen or sudden enlargement of the abdomen. Investigations for water accumulation in the abdomen usually focus on liver or heart problems. However, in women, the ovaries also need to be examined. When undergoing tests for liver or heart in these circumstances, do not forget to get an ultrasound of lower abdomen to check the condition of your ovaries. Chest pain. In cases of chest pain that physicians and cardiologists cannot figure out the exact cause of, an ultrasound of the lower abdomen should be done to see if the cause is hidden within the ovaries. We have discussed these surprises in another study on pseudo-ovarian problems, ovary in disguise. Link will be as below. If there is no direct lung or heart causes of chest pain or shortness of breath found, get an ultrasound of the lower abdomen to check the health of the ovaries. Even if the symptoms are in the chest, you need to check it on the abdomen. So that's all today. See you soon over another video research.